Mary.
Hi.
Is this your first time seeing him on the ventilator? Yeah, it can be a scary thing to watch. You want to sit down and talk about it?
Andrew being nice to patients and educating them.
Is it hurting him?
So there can be a little bit of discomfort with the tube in your throat, but just remember, discomfort is different from severe pain. I'm going to do everything I can to make sure he's not in pain.
So he's getting pain medicine right now?
So he's on some pain medicine now, and most people on the ventilator are on pain medicine and sedation so that they can relax enough so that the ventilator can do its job.
How are you going to know if he's in pain if he's asleep?
That's actually a really good question. So I look for other things that he's doing. Maybe he's moving around a lot. Maybe his brow is really furrowed or his face is red. I look at his heart rate and his blood pressure and see if those are getting higher.
So then he'll just be asleep the whole time?
So for today, yes. In most cases, we wake everyone up every morning. However, just to see if they're confused, can they move their whole body? How are they breathing without sedation?
Okay, so then you wake him up to check those things and then you put him back to sleep?
That'll kind of depend on him. Some patients, if they're doing okay, can be awake the entire day. A lot of people need only a little bit of pain medicine and then they're awake, then they're watching TV and they're on their phone or they're reading a book.
Oh, I hope so. I really want to talk to him.
You can talk to him now, though, and you can touch him. I always talk to my patients as if they can hear me.
Oh, good. Oh, thank you. Yes.
But I do reserve the right to ask you or a family member to step away if I feel like he's getting overstimulated or if he's breathing too fast or something is happening, just because I want to keep him extra safe.
Of course, yeah. Whatever you think he needs.
Now I notice that his arms are tied down. We do, because you have to remember this is a life-saving measure. A lot of people, their first instinct when they wake up is to pull that tube out of their mouth, and we really don't want it to come out if it's what he needs right now.
Can we untie him if I sit next to him and watch him?
No, not right now. And I'm just saying that because I want him to be extra safe. If in the coming days he wakes up and he's not confused and he's following the rules, then we could probably untie him.
What's happening? He's coughing a lot. Does he need more pain medicine?
He's okay. See, he stopped.
I'm sorry, I'm just so jumpy right now.
It's perfectly fine. Just think of it like this. We all cough. I cough, you cough, and it's not an emergency when we cough. The only time I would really give him extra pain medicine is if he was coughing so much that the ventilator was having a harder time working or if his oxygen level was dropping. I think the alarms probably scared you too.
They did, and they're so loud. Do they have to be that loud?
Yeah, they have to be loud enough so that we can all hear them even when we're not in the room.
What does it tell you when it alarms?
There are so many reasons a ventilator could alarm, and I want to assure you that for most of those, it's not an emergency. Okay. Alarms give us information about how well he's doing on the ventilator. Maybe he needs more sedation or less sedation. Maybe he needs to be suctioned.
And so then what did it tell you this time when it went off?
Well, he was coughing, so when you cough, the pressure in the system goes up and it triggers a pressure alarm, and it just kind of lets us know to continue to watch him in case he continues to cough.
Do you know how long he's going to be on this ventilator?
So everybody's different, and we assess a patient every single morning to make sure that they're ready.
So then what kind of things are you looking for?
There's actually so many things that we look at that I'd have to make a different video for that.
What?
But I can tell you based on his ventilator settings that he's probably going to be intubated all day today and probably all day tomorrow.
So how do you know that? Like, what specifically are you looking at there?
So I'll give you one number that you can kind of track on your own, and it's this one right here. It's called FiO2, and it's how much oxygen he's requiring. So right now he's at 90%, and in this hospital, he needs to be down to 40% before we would even think of taking the ventilator off.
Okay, so then if I come in tomorrow and it says 40%, does that mean we can take it out?
Not necessarily. Like I said, there's so many factors that we look at. I just wanted to give you a number that you could look at and see how close we might be getting.
So then let's say that all the factors are right and it can come out. So then what happens then? What do you do?
So when it gets close to that time, I'll sit with you again and we'll talk about all of those factors and what we're looking at. This video is already kind of getting long.
What video? Am I on TV?
Shh.